If you're waiting for obvious red flags to identify autism, you're already falling behind. Early autism doesn't look dramatic, it looks subtle and cumulative. At this point, the research delivers a reality check. Early autism risk can be identified with surprisingly simple questions if you ask the right ones. By 9 months, four specific behaviors consistently differentiate infants who later receive an autism diagnosis from all other groups. These aren't specialized lab measures, they're everyday interactions. Does your infant orient when their name is called? Do they imitate simple actions or sounds? Do they engage in back and forth vocalizations? Do they make and maintain eye contact during interactions? When these four questions are combined with structured parent report using the Autism Parent Screen for infants, researchers were able to predict autism outcomes at 36 months with about 70% accuracy. By 9 months of age, this is not diagnosis, it's early risk identification. What matters is that none of these behaviors works in isolation. It's the pattern across them that signals concern. Reduced responsiveness across multiple social communication domains tells a very different story than a single delayed skill. Early autism is identified by convergence, not checklists. This is one of the most counterintuitive findings in autism research. Between 6 and 12 months, infants who later receive an autism diagnosis are often described as less active, more adaptable, and more socially approachable than other high risk infants. On the surface, that sounds reassuring. But what the studies show is that these temperament traits don't remain stable. Over time, infants later diagnosed with autism show declining adaptability and approach behaviors, while other high risk infants improve. At the same time, these infants show lower surgency, less smiling, less pleasure, less approach behavior, and greater negative affect, including sadness, fear, and distress. Differences peak around 12 months, even earlier. By 6 months, reduced regulatory capacity appears, less orienting, less soothability, and reduced cuddliness. The takeaway is critical. Early, easy baby presentations can mask risk unless development is tracked longitudinally. Some early autism risk factors fall outside classical social communication but still matter. Between 6 and 18 months, infants later diagnosed with autism are significantly more likely to experience gastrointestinal symptoms such as constipation, diarrhea, or food intolerance. These are not diagnostic markers, but they contribute to regulatory strain. Family structure also plays a role. Infants from multiplex families, those with two or more older siblings with autism are more than twice as likely to receive a diagnosis compared to infants with only one affected sibling. By 36 months, only about one third of multiplex infants are typically developing. Cognitive and adaptive differences also emerge early. In single incident families, infants later diagnosed with autism show lower cognitive scores by 6 months and lower adaptive functioning by 12 months. None of these factors determines outcome alone, but layered on top of social, motor, and communication differences, they amplify risk. Autism risk accumulates. Let's talk about why early autism so often goes undetected. The earliest autism markers are usually deficits, not excesses. Infants aren't doing something strange, they're doing typical behaviors less often, less eye gaze, less joint attention, fewer gestures, reduced social smiling and affect, slower motor coordination. Across the studies in this review, 84% of early findings involved reduced frequency of typical behaviors. Only 16% involved behavioral excesses like repetitive behavior or gastrointestinal symptoms. Deficits are harder to see without comparison. If a behavior is present, just less frequent, it doesn't raise concern. That's why binary screening tools struggle. Early autism looks quiet, not disruptive. This research points to a necessary shift in practice. Early detection must rely on ongoing developmental surveillance, not one time screening. Autism risk is cumulative. Prospective dimensional tracking matters. Asking how often a child responds, initiates, or engages provides more information than asking whether they do it at all. Interdisciplinary approaches are essential. Early motor differences cascade into communication delays, which means occupational and physical therapy should be involved before diagnosis when risk is emerging. High risk populations, especially multiplex families, require closer monitoring, not reassurance. The message is not to screen harder, it's to track development smarter. Here's the bottom line. Autism symptoms can emerge as early as 6 months. When measured properly, regression of social communication is common, and the earliest signs are reductions in typical behavior, not obvious abnormalities. Early autism isn't about what the child is doing wrong, it's about what development is doing differently over time. Once you understand that, early detection stops being controversial, it becomes unavoidable. Identification isn't about labeling children sooner, it's about opening doors sooner.